If you are over the age of 60 and currently living in the United States, pause whatever you are doing right now because something that has just passed in the United States Senate could have a direct effect on your retirement, your health care, and your financial stability beginning this very year. Bernie Sanders has advanced a significant elder care protection bill, and millions of retirees throughout America still do not completely understand what is included in it. We are talking about stronger protections against abuse in nursing homes, new limits on prescription drug costs for seniors, and revised rules that could result in more money being added back into your Social Security payments. However, here is what most major media outlets are not fully explaining. Not every change takes effect automatically. Some benefits only apply if you know the proper way to claim them. There are also critical deadlines that you could miss if you wait too long. In this video, we are going to explain every key update in simple and easy to understand language. No confusing legal terms, no political bias, just clear facts so you and your family can understand exactly what you qualify for and what steps you need to take right now to protect your future. If you believe that every senior should understand their rights, press the like button now. It only takes a moment and helps us spread this important information to more retirees like you. Let's make sure nobody gets left behind. Welcome back, everyone. If you have been following the news lately, you probably already know that something significant just took place in Washington. Something that directly impacts you, your spouse, your parents, or anyone you care about who is over 60 years old. The United States Senate has officially passed the Elder Care Protection Bill, and Bernie Sanders has been leading this effort for many years. This did not happen overnight. It came after long debates, committee evaluations, setbacks, and several revisions. And now it has officially become law. Today, we are going to go through everything you need to know step by step. No rushing and no skipping important details, because you deserve to understand the complete picture. Let's start from the beginning, because knowing where this bill originated helps explain why it is so important. For decades, seniors in this country have faced challenges with a system that often did not fully support them. Prescription drug costs kept increasing. Nursing homes operated with limited accountability. Social Security adjustments did not always match real living expenses. Financial scams targeted older Americans and drained their savings. These were not minor concerns. They were serious problems affecting millions of households, and much of it happened without enough attention from lawmakers. Bernie Sanders made it a priority to push for reform. He organized hearings, brought seniors to testify before Congress, and continued pushing until progress was achieved. Now we are seeing the outcome. This Elder Care Protection Bill is one of the most comprehensive pieces of legislation focused on seniors in decades. It covers health care, housing, financial security, and personal safety. While headlines only highlight the basics, the real importance lies in the details that impact your daily life. Let's begin with prescription drug pricing, because this is one of the most significant changes. If you are on Medicare, this is something many people have been waiting years to see. Previously, Medicare was not permitted to negotiate drug prices directly with pharmaceutical companies. Think about that. The largest purchaser of prescription medications in the country could not negotiate prices, while private insurers and even the Department of Veterans Affairs could. This resulted in seniors paying some of the highest medication prices in the world. Under this new law, Medicare can now negotiate prices for a wider range of drugs, and those negotiated prices will be introduced more quickly. This means that if you are currently spending hundreds of dollars each month on medications, those costs could start decreasing on a rolling basis in the near future. There is also now a cap on out-of-pocket drug expenses, meaning there is a maximum amount you will pay each year, regardless of how many prescriptions you require. For many seniors, this change alone could be life-changing. Now, let's move on to Social Security, because this is where many people pay very close attention. Social Security has been a fundamental part of retirement since it was created in 1935. It was designed to provide stability after years of work. However, over time, many people felt that adjustments were not keeping up with real costs. The issue largely comes down to how inflation is calculated. The current system uses data based on working individuals rather than retirees. But seniors tend to spend more on healthcare, medications, and essential services, which often increase in cost more rapidly. This new bill pushes for an updated method of measuring inflation that better reflects senior spending. Over time, this could result in higher annual adjustments, meaning more money in your monthly payments. It may not seem like a large increase at first, but over the years, it can add up significantly. The bill also includes measures aimed at strengthening Social Security funding over the long term by adjusting payroll tax limits for higher earners. This helps stabilize the system and reduces the risk of future benefit cuts. Next, let's talk about nursing home reform, which is a crucial part of this legislation. For anyone with loved ones in care facilities, this is extremely important. Reports have shown ongoing problems in nursing homes, including understaffing, poor conditions, and even cases of abuse. The new law introduces stricter staffing requirements. Facilities must now maintain minimum caregiver to resident ratios. This means better attention, quicker response times, and improved quality of care. Penalties for violations are also being increased. In the past, fines were often too small to make a real difference. Now, repeated violations could lead to the loss of Medicare and Medicaid funding, which is a serious consequence for facilities. Transparency is another major improvement. Nursing homes must now provide easier access to inspection reports and performance data, allowing families to make more informed decisions when choosing care. Now let's examine elder financial fraud, which has become an increasing problem. Every year, older Americans lose billions of dollars to scams. These include fake government calls, investment fraud, and even exploitation by people they know. This bill increases funding for fraud prevention and enforcement. Financial institutions are encouraged to monitor suspicious activity and report it. There are also new awareness programs designed to educate seniors on how to recognize scams. Knowledge remains one of the strongest forms of protection. Housing is another important area addressed in the bill. Many seniors want to stay in their homes, but those homes often need modifications to remain safe. The bill expands funding for home improvements such as ramps, wider doorways, and safer bathrooms. These upgrades help seniors maintain independence for a longer period of time. There is also investment in affordable senior housing communities designed for accessibility and social interaction. This helps reduce isolation, which has been linked to serious health risks. Mental health is also included in the legislation. Access to therapy and counseling through Medicare is being expanded, including telehealth options. This is especially important for seniors dealing with loss, chronic illness, or loneliness. Caregiver support is another major focus. Millions of family members provide unpaid care for loved ones. This bill introduces tax credits, training programs, and respite care options to assist them. There are also steps being taken toward expanding Medicare coverage for services such as hearing, vision, and dental care. While not fully implemented yet, progress is being made through subsidies and pilot programs. Additionally, the bill strengthens protections against age discrimination in employment and healthcare, ensuring that seniors are treated fairly and with respect. Now, here is something very important to understand. Not all of these benefits are automatic. Some require applications, updates to your information, or action within specific deadlines. To begin, you should check with the Social Security Administration or visit their official website. You can also speak with a Medicare counselor through your state assistance program. These services are free and designed to help you understand your choices. Also, be careful about scams. No legitimate agency will ask for payment or personal information over the phone. If something feels suspicious, contact official sources directly. As we come to a close, think about what all of this means for you. This bill is not a perfect solution, but it represents a significant step forward. It addresses real challenges and provides meaningful support for seniors across the country. Most importantly, it shows that your concerns are being recognized moving forward. Staying informed is essential. Understanding your benefits and taking action when necessary can make a major difference in your financial and personal security. If you found this helpful, share it with others who may need this information. The more people understand these changes, the better prepared everyone will be. And remember, this is your future, your security, and your right. Stay informed, stay proactive, and we will see you in the next update.